Latest on the fight against COVID-19. Health officials are now recommending that all Americans cover their face in public.
The CDC is recommending that Americans wear a basic cloth or fabric mask. They can be either purchased online or simply made at home, probably material that you'd have at home. These face coverings can be easily washed or reused.
Now, President Trump right there pointing out that this is a recommendation, not a mandate. And the idea is to wear non-medical masks in places where it's difficult to stay 6 feet apart. For example, the grocery store or maybe the pharmacy. Our Fox 12's Audrey WEIL is live in Northwest Portland for us tonight, breaking down what to wear and when to wear it. Audrey?
Right, Bonnie, the CDC is talking about those cloth face coverings, and those can be made out of old scarves, t-shirts, bandanas, handmade with fabric and sewn. What we should not be wearing are medical masks. Officials say it is critical to save those for the healthcare workers.
There are 2 layers of quilters grade cotton and then a layer of interfacing in the center.
Katie Hovanek was hesitant at first to start making face coverings. She wasn't sure if they really were useful.
But finally, I thought, okay, seems like they're using them, so I started making them. We felt like it's better than nothing.
Other people in her neighborhood seemed to feel the same way. Hovanek snapped some pictures of a neighbor's tree with masks hanging like ornaments, free for anyone who wanted one, and all gone in a matter of hours.
My husband's been wearing them. He's been better about it than me.
And Friday afternoon came some reassurance in a new recommendation from the CDC that yes, these kinds of coverings are useful for the general public in places where it's hard to maintain social distancing, like grocery stores.
People are still spreading it to each other, and we're just trying to do our part to not do that.
Health officials say that's the right way to look at it. The person wearing the mask is the one preventing the spread, helping to protect those around them. That's because cloth face coverings can block infectious droplets that come from coughing, sneezing, and talking before people even know they're sick. But the coverings are supplementary.
The face covering does not replace staying at home and staying away from others and staying at home, especially when you're ill. Please do not interpret this recommendation as okay to go out as long as you're wearing a mask or okay to go out if you're sick as long as you're wearing a mask.
Health officials say still staying home when you're sick, only going out for essential needs, and keeping 6 feet apart are the best measures to prevent the spread of COVID-19.
And for those face coverings, health officials say the tighter the weave of the fabric, the thicker the cloth, the better it fits your face, the more protection you're going to have. They're also saying that we need to be washing these masks after every use. Live in Northwest Portland, Audrey WEIL, Fox 12 Oregon.